When you talk about involvement on the ward, it's really a constantly evolving cycle to us, really. The sort of things that we look at would be to involve carers, carers on the ward to get feedback about somebody's care, how we can improve somebody's care. Often a quite objective view can be very helpful to us and help us improve the service. We don't always get it right. It's important that we listen to people and gain that feedback for that improvement to the service. It's also helpful to speak to carers and people who are involved in a supportive network to gain information that could help somebody to recover. So they may know of somebody how they are normally, whatever normally would be, as to kind of say that these are the things that somebody likes, this is what can benefit somebody, this is how they usually would behave, and this is not them at the moment, and that can often be very, very helpful to gain that information and can often shorten an admission considerably for the person. We have one volunteer with us at the moment who's come with a very positive attitude, and it's often helpful to have a volunteer on the ward to be someone who can advocate a bit more for the patient. The patient sometimes feels more comfortable with a volunteer and can discuss more openly things that can be helpful to the patient as well. You can well imagine that if you have a loved one that's in hospital, it's very confusing, especially when somebody might become unwell for the first time perhaps, but throughout really it can be confusing. You need that support, you need that reassurance. Obviously look to involve patients within their care, in collaboration with carers and supportive networks as well. So it's been long-standing that all supportive networks and carers are at reviews and they're asked their opinions at reviews. It's their care and they quite often know best about it really. For us not to dictate and take the stance that we know best. Sometimes obviously we do have a professional knowledge that could help, but we need to educate people and empower people in that respect. Within our service we often talk to patients about the ward. You know, it's an environment where people are there 24/7, sometimes for lengthy periods. So we want to make sure it's meaningful to that person. So we often have patient meetings where we'll ask about how the environment is, what can we do to improve the environment, what sort of facilities could we provide, and if we can't provide certain facilities for reasons such as health and safety or something like that, we'll give a reason as to why we can't and keep revisiting that and updating patients as well. You know, it is a different environment than being at home, definitely, but we try and normalise that environment as much as we can. And practical steps, if people would like more activities, we look at what we can offer, such as football sessions and training sessions and any trips that people might want to go on, and people have suggestions about the locality and where to go. Things like that. They might want practical things such as DVDs, more different types of DVDs, a change to the food that they receive, innovative ideas like the use of a projector for cinema evenings or something like that, which has definitely been a benefit, and a lot of that has come from the patients rather than ourselves. To get that feedback and constantly evaluate your service without stopping still and evolving based on what people have experienced of the service is it allows us to progress and listen to people and promote engagement and ultimately get that outcome of somebody recovering more quickly and getting to where they want to be, which is being at home rather than in hospital.